For trading it all.
So welcome back. Now, my next guest has also been on before. One time I have with me now Dr. Brian Cafaro. He's the owner of Balance Hormone Center. Welcome to the show, Doctor. You got to tell everybody a little bit about what you do, and what we're going to do is a giveaway today. Because listen up, guys, this is great. He was on before. He got lots of calls. Let's go ahead and talk about what you do.
Okay, well, again, I'm Dr. Brian Cafaro. I own Balance Hormone Center in Gilbert, Arizona. And what we do is try and manage people's quality of life, and we do that through hormone replacement. A lot of people don't realize how important hormones are. These are messaging molecules that help regulate the body's processes. As we age, we don't tend to make as many hormones, and people start becoming symptomatic. One of the main reasons people come and see me is they feel tired all the time, and they think, oh, I'm just getting older, I'm stressed out, I work too much, I have kids. But it's not. Sometimes it is that, but a lot of times it's not. And we separate into men and women because they go through two different life stages. The women tend to go through menopause, which means their estrogen goes down. They get the hot flashes, the night sweats, they're moody, they're driving their husbands nuts.
Careful. Go ahead.
The men go through what's called andropause, which means their testosterone starts to decrease, and they find that their libido decreases, they're tired all the time, they start losing muscle mass. The ones that go to the gym, they just don't get anywhere with it. They feel like they put in all this work, they can't lose weight, they don't gain any muscle, and a lot of them quit going.
Well, men, if you think it's just for women, you're wrong. So there you go. You just heard it from the doctor himself. So it does happen to men too.
Absolutely. And most of the time what happens, we'll have, if it's a married couple, the husband or wife will come in and they get to feeling great, and the husband or wife of whoever came in will come in and see me because they want to say, I want what they're having.
Sure, absolutely. Now, you do something that you want to do as a giveaway. We did it last time. People loved it. It's a blood panel analysis, and you get a vitamin B12 shot that goes along with it. People love those. Let's tell them what they're getting with that.
So with our offer, we're going to check your hormones, okay, to see if you're out of balance, if you're deficient, go over your symptoms. We do offer a free consultation for those that call in too. And in addition, we are given the vitamin B12 shot, and that'll give you a little boost of energy, and everybody needs that.
And everyone loves those. Now, you do free consultations. We're going to enter everyone in to get those. Our number, is everyone going to get them? I forgot what we did the last time.
Everybody that calls in is going to get it.
So everyone is going to get this. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Now, if you're driving with someone, if you're listening to this or wherever you are and you know someone that has an issue, let's get you both in there. We want everyone to have this. Again, our number here is 602-277-5369. And toll free, it's 1-866-536-1100. You could check him out on his website. It's balancehormonecenter.com. You can also call them direct. That number is 480-718-9960. Or call in here. You're going to get the blood panel analysis along with that vitamin B12 shot. It's a $275 value, free to you, and everyone's getting it. 602-277-5369. And toll free, it's 1-866-536-1100. So how would someone be able to tell if they needed hormone replacement therapy? What are some of the symptoms? You said for women, is it, it's not just the hot flashes, is it?
No. Just like I'd mentioned with the men, some of the women will feel like they are losing some muscle mass. Again, their sleep can be disrupted. They're tired during the day all the time. And their libido will decrease as well.
It's not always that they're nasty.
No, I was just kidding with that.
Yeah, no, but that's true. We know about that. We as women, we know. So what? And the men, they you said that more or less, it's more the libido that happens. They're tired and sluggish, right?
Yep. And again, with most of my patients that come in, they're active people. They want to continue to stay active. They want to continue to do well with their work. One of the things I hear too from both men and women is something called brain fog. So they don't feel like they're as sharp as they used to be, and sometimes, especially if they're in a real competitive environment at work, they just don't have the edge that they used to.
Do you have to be older to have your hormones go out of whack?
No, you don't. Basically, after age 30, your hormones can start becoming out of balance.
How about teenagers? Do they ever come to you? Do the teenagers, girls that go on, do theirs get out of whack too?
We don't typically see teenagers.
Not as much, huh?
Because they're going. Most of them are going through puberty or getting to the end of that.
I always think that theirs are out of whack too.
Well, they're elevating so fast that's why you see a lot of the behavior changes and physical changes in the teenagers.
But it can happen to anyone after the age of 30, so you can't have that happen.
Absolutely. And what we do, we go through all your symptoms. We check your lab works to see how we can help you out. A lot of people ask me, well, how do you treat this sort of thing? One of the most popular things we do is a pellet implant. So this looks like a little grain of rice. We make a small incision and it gets put underneath your skin, and that would be either testosterone, estrogen, or especially in women, in many cases, both. And for women, they last about 3 months. So they get put in. You don't have to even think about anything. They do the job. They're constantly releasing hormones every second of every day. And at the end of the 3 months, we check your labs, see how you're doing, and see if you're ready for another one. And the feedback I get is the longer you do it, the better you tend to feel. And the other thing I always tell every patient is this is a quality of life thing. It's not something you have to continue to do. It's not like a blood pressure problem or diabetes problem where you need to treat that, your entire life. But most people do continue to do it
because they feel better.
Absolutely.
What else do you do besides the pellets? You do other things, right?
We do. For men, we do testosterone injections. You would get that anywhere between 7 and 14 days, depending on how fast your body metabolizes through it and how your labs look. Kind of determines the dose you need, how often you need to do it. There's something called troches. These are little lozenges that dissolve.
I'm in for that.
Dissolve in your mouth if you don't like the needles or
there you go.
Or get cut on at all. There's creams that can be put on the skin every day, and that applies to both men and women. So we just give everyone options and see what fits best for them, and then come up with a plan.
They do free consultations. They're also offering for everyone. Everyone is going to get a blood panel analysis. This is free to you, and a vitamin B12 shot that comes along with that. Everyone loves those. It makes you feel better right away. Mm-hmm. That's a $275 value, free to you or anyone you know. Give us a call here at 602-277-5369, and toll free it's 1-866-536-1100. You could check them out at balancehormonecenter.com. They also do free consultations, so you can call them at 480-718-9960. And what did you say? This is Messenger's what did you say?
They're messaging molecules.
Messaging molecules. Get your molecules checked out, right? Is that
Absolutely.
What it is?
Yep. So your brain is monitoring your hormone levels every second of every day, and it's sending signals to all the other organs in your body, basically telling them what to do.
Is it safe?
Absolutely, it's safe.
Right. I think a lot of people want to know, are they safe? They're skeptical about certain things.
Yeah, there was a big study out in the 90s called the Women's Health Initiative study, and that study found that taking synthetic estrogen unopposed may cause or lead to breast cancer. And so that kind of put a whole black eye on the whole hormone replacement therapy. But we've done lots and lots of studies. We found what's safe to do. They found that taking progesterone as you take estrogen really gets rid of risk of uterine cancer, breast cancer, and some of the other negative side effects.
Well, if you have any questions, the good thing is that they'll talk to you about that, and you only know unless you talk about it. You can read a lot of different things, but when you talk to a doctor, which you are, then you're going to get the full analysis of what it is. Again, our lines are open here. We're going to let everyone call throughout the rest of the show for it. It's a free blood panel analysis and a vitamin B12 shot that you get along with that. It's a $275 value, free to you. Call us here, 602-277-5369. Toll free, it's 1-866-536-1100. We're going to go to break. When we come back, we're going to talk further about what he can do to help us, and all of us, men and women.
If I traded it all.
So we're talking hormones. We're talking with Dr. Brian Cafaro. He is the owner of Balance Hormone Center. Our lines are open here, and he's giving everyone this blood panel analysis and a vitamin B12 shot. And we're going to let everybody call throughout the rest of the show for it. It's a $275 value, free to you or anyone you know. Our number here, 602-277-5369. Toll free, it's 1-866-536-1100. You can always check them out at balancehormonecenter.com. I say call in. One thing I want to ask you, I know you have some, stories that you want to talk about, but first of all, I think another thing that people want to know, you said it's safe, but are there side effects?
For most people, no. I mean, we say side effects as benefits. They feel better, more energy, increased muscle, better libido. As far as negative side effects, for the men, you could potentially get some acne on your face or back if you were prone to it when you were a teenager. For most men...
That's fixable.
Yeah, it's fixable. And for most men, after they've been on it for a little while, it goes away because their body gets used to it. Mm-hmm. Some men that are predisposed to hair loss, they may see some hair start falling out. Doesn't happen very often. If it does start happening, we have medications that can help stop that process.
Right. And for women?
For women, it would probably be the breast tenderness. Mm-hmm. Probably about 10% of women that come in and start estrogen therapy, they will feel some breast tenderness. Generally goes away. Don't have to do anything for it.
Right.
The women that get testosterone, they can also get some acne.
Right. And there's always something that you can do to help them. You have many different possibilities that you can do for them. It's not just one thing that you do. You can offer options. His website is balancehormonecenter.com. He does free consultations for us that's calling in. Everyone is getting a blood panel analysis and that vitamin B12 shot that goes along with it. It's a $275 value, free to you. 602-277-5369 and toll free, it's 1-866-536-1100. So what are some of the stories that you've heard that I've had?
Well, one that comes to mind is I had a male that came in. He was in his late 40s. He was a real estate agent, and he came in and he said he's very, very sluggish at work, and he had to take 2 naps a day in order to function. He was just that beat. He had young kids. He just felt like he didn't have the energy to play with them. Came in, we checked his testosterone, very, very, very low. He actually had the pellet implants done. 2 weeks later, he came in, said, haven't had to take a nap in 2 weeks.
Wow.
I feel great. I didn't think it would help this much, but it did. A month later, his wife comes in. She was starting to get the hot flashes, and she just wasn't sleeping good. And so we took care of her too, and they've been coming for months and months, and I think they'll continue to do it for indefinitely. Well,
I'll tell you something. I think that most people who are dealing with this type of a thing, you know that you want help, you know that you can get it, and the only reason why, if you were to not call, is that you would think that they would have some form of thought that it would not be good for you. Right. Right.
Again, there's some studies that were done years and years ago that for hormones where they were using some of these synthetic hormones, which some of them are actually made from horse urine, and we're not horses, so we shouldn't be using horse hormones.
Right. Do you make some for them? If they, there's a lot of people that like to get them made for them. Is that something that you do also?
Yeah. In fact, we only use the bioidentical hormones.
There we go. I want to talk about that. That's a big deal. Go on.
Yeah. So bioidentical hormones they're actually made from yams. Okay, and a lot of people don't know this, but biochemically, yams have the exact same estrogen exact same testosterone as we do. And so by using those, you're giving your body the things it already has. And so that's why we typically don't see any side effects with them, because we're just supplementing them. Say you have a thyroid problem. How do you fix it? You give them more thyroid hormone. Okay, it's the same with these other hormones.
Okay, and so that's important to know, because a lot of people, they are considering they want to have the bioidenticals. Everybody's heard a lot about that, and I'm glad that you mentioned that, because some people wouldn't know that unless you did.
Mm-hmm.
So I'm glad you did. So again, we've got our lines open here, and everyone's going to get the blood panel analysis that comes along with that vitamin B12 shot. We know we all like those because we're all sluggish, whether you are or not. And okay, so and you might just have your hormones out of whack. That's a $275 value, free to you. You're going to get a free consultation along with that. Our number here is 602-277-5369, and toll free it's 1-866-536-1100. You can check them out. It's balancehormonecenter.com. You can also call them direct at 480-718-9960. But I say call in here. Get yourself, everyone's getting it, so give us a call, 602-277-5369, and get your analysis done with the vitamin B12 shot. One thing that I wanted, you do other services. Let's talk a little bit about those as well. Go ahead.
Sure. So one of the things we do is help patients with weight loss. A lot of them have tried all the Weight Watchers and diet and exercise, and they just feel like they're not getting anywhere. Sometimes they can't lose the weight because their
hormones are out of whack.
Well, we do help fix that, but in other cases, they're just unfortunately genetically predisposed to being a little bit heavier. We counsel them on diet and things they should and shouldn't be eating, but a lot of them need a little bit more help than that. So we offer several different medications that help decrease the appetite, rev up the metabolism a little bit, and help them not only get the weight off but keep it off. There's so many people that are able to get the weight off, but then they rebound and are right back to where they started. We offer what's called the HCG diet. That HCG is a hormone that does help you decrease your appetite, and it also focuses in on that fat around your belly. The thing with the HCG diet, you are eating 500 calories a day, but you aren't hungry with it. And you can do it for 23 days or 40 days. You lose about a pound a day. It does work. It works very well. Some of it is a willpower issue, but most people do very, very well with it. And we want to help them keep that weight off. And once they start seeing these pounds come off, they become very, very motivated to keep on with it, and then making some lifestyle changes afterwards.
And what else do you offer?
Yeah. So we offer aesthetic medicine, such as Botox. As we age, people will get wrinkles in their face just from the effects of gravity, and hormones. We offer fillers. So again, if your face is starting to sag, you just don't have the volume around your cheekbones. If you think your lips are a little bit too thin, we can inject some fillers in those and just give people a little bit more confidence. And when we do it, we try and make people look very, very natural. You see a lot of celebrities that have these things done and sometimes overdone. Mm-hmm. But the way we do it, we're just trying to enhance your natural beauty.
Right. Well, you're
a
doctor.
For men and women.
I bet you do. So again, you're a doctor, and so you know exactly what you're doing, and that's also very important. Again, you could check them out. They're at balancehormonecenter.com. Hormones can affect you in many, many ways. It's both men and women, and it's not fun, and you should feel good. Why shouldn't you? And so he's offering for everyone is going to get, and I'm going to let you keep on calling throughout the rest of the show, get that blood panel analysis and that vitamin B12 shot that comes along with it. You're getting that free consultation. It's a $275 value, free to you. Our number here is 602-277-5369, and toll free it's 1-866-536-1100. Keep on calling, guys. Get entered into, no, not entered into, when everyone's getting this. If it's you or someone that you know, that's what I love about this show. If it's you or someone you know that's dealing with this, get them into this. It's a free blood panel analysis and vitamin B12 shot, 602-277-5369. What are your final words for today?
If you've gone to your family doctor for any of these symptoms that we've discussed and they told you that you're normal and everything's fine and just live with it,
You're not.
come and get a second opinion because we can usually find something to help you out.
Sure. Again, when they do this blood analysis, how do you do that? I mean, how long do they take to find out whether or not? Did you do it in-house? Did I think that you said? I don't remember. Tell me what you said last time.
We draw the blood in-house.
There you go. Tell them what you did last time. I don't remember what it was.
Yeah, so we do an IV blood draw. We send your blood to the lab. We get the results back the next day. We will call you and let you know what they show and what your next step should be. And usually we do find something in people, and we'll have them come in the office and go over all these options that I talked about.
So they do it all in-house, which is really nice as well. They're located in Gilbert. Their phone number is 480-718-9960. They're going to give free consultations to everyone. Call in and get that blood panel analysis. It's free to everyone that's calling in. I'm going to let you call throughout the rest of the show. You're getting a vitamin B12 shot that goes along with that. We all love those. That's a $275 value, free to you. 602-277-5369 and toll free it's 1-866-536-1100 and feel better today.